Breaking news. Washington is in a state of emergency after a King County man is the first person in the country to die from the coronavirus.
I want to just start by expressing our deep and sincere condolences to the family members and loved ones of the person who died.
Tonight we go in depth.
We're in the process of investigating this situation as an outbreak,
with health officials concerned.
Should we start to see more spread in Washington, we might consider some measures such as canceling large public events.
And now the White House is signaling a stronger response to the outbreak.
They've already started working on it, developing very rapidly a vaccine for the virus, to combat the virus.
KIRO 7 News presents the coronavirus emergency. Tonight, Washington Governor Jay Inslee declared a state of emergency as the number of confirmed cases starts to rise. And good evening, I'm Dave Wagner.
I'm Tracy Leong. Tonight, the coronavirus concerns are spreading after the first confirmed death in the country. Dozens of residents at a local nursing facility are now being tested for coronavirus. And the Centers for Disease Control is sending experts here after this surge in possible cases. Tonight, we bring in Swedish's Director of Quality and Safety, Elizabeth Mead, in an attempt to answer your questions and concerns about this fairly new outbreak. But we begin with details about the first patient in the U.S. to die from the disease.
KIRO 7's Jessica O starts our team coverage tonight. Jessica, what do we know at this point about the local man who died?
Dave, we know that man was admitted here to Evergreen Hospital with severe respiratory problems, and that hospital staff just felt like something was wrong, decided to screen that man for coronavirus. We're told that he died within hours of that test coming back positive.
We felt he was at a higher risk and had an unexplained respiratory infection.
When a man in his 50s was admitted to Evergreen Hospital in Kirkland, he was flagged for a coronavirus screening even though he hadn't traveled.
The individual, someone with a significant number of comorbidities. He was a chronically ill person.
He died Saturday after testing positive for coronavirus. We asked health officials if the patient was a member of the long-term health care facility where 2 more people tested positive for the virus today. They told us that's not the case, but also said they're actively testing people at that facility.
Are gearing up our team to be able to test specimens around the clock 7 days a week.
We know Washington State's testing up to 200 people for coronavirus every single day, and the CDC's change in testing guidelines may be what's helping spot more cases.
and that's how we uncovered the local cases, by dropping the travel criteria and testing patients who had an illness that was serious.
We asked people who live and work around the hospital if they're worried.
I am not worried about it, as long as we wash our hands and, try not to touch our faces too much. I think we'll be all right.
Health officials say the focus now is figuring out how these patients got the virus and keeping it from spreading.
It's very important for everyone to remember that 80% of the cases are mild. You can think of it as a bad influenza-like infection.
But on the other side of that, he also told us today's death shows us how severe this virus can be. And he says it also leaves hospitals like this really preparing for the worst case scenario. Officials say their top priority now is making sure that people at facilities like this, everyone from patients to staff, are all safe. For now, reporting live in Kirkland, I'm Jessica O, KIRO 7 News.
Jessica, thank you. 2 cases of coronavirus are linked to a nursing facility in Kirkland, but there may be many more. Our team coverage continues with KIRO 7's East Side reporter Allison Grandy, who is live at that facility.
Tracy, so there are 2 people here at this care facility who tested positive for coronavirus. Neither of them had traveled anywhere, and they had not been around family members who had, but it gets much bigger here. In fact, we're told there are about 50 people, workers and patients here, who have symptoms and could possibly have the coronavirus. They are all being tested tonight.
We are wearing masks today. When I went in there, everyone has a mask on.
At Life Care Center of Kirkland, when Antonia Lopez came to work, she saw this sign outside. No visitors were having an outbreak of respiratory illness.
Well, I saw that in the news crew and I went, I wonder what's going on.
We watched paramedics suit up in protective gear before going inside. So far, a woman in her 40s who works at the long-term care facility and a patient in her 70s have both tested positive for the coronavirus. Neither had traveled. As many as 50 other people, workers and patients, have respiratory illness and are being tested. Word of the new cases and the death overnight at Evergreen Hospital have residents worried.
I'll take precautions, wash my hands and try to be careful around other people and if I start feeling sick, self-quarantine.
And the other one is, oh, you can just wash your hands, don't touch your face. But like, you try to tell that to a kid.
Humberto Castaneda has 2 young children and is ready to keep them home if necessary.
Like, we've bought some extra resources and we're expecting we might have to stay home for maybe a few weeks. Hopefully it passes.
The Centers for Disease Control will help the health department track the Kirkland outbreak to figure out where it started and work to keep it contained. Antonia Lopez is a phlebotomist who draws blood from patients at the care center a few days a week.
As long as you do your job properly, you have nothing to worry about.
Now, the CDC will have a team of 10 people here at this care center tomorrow working to figure out where this started and trying to stop it. And just in the last 10 minutes, we got a statement from the president of the Lake Washington Institute of Technology. So last week, there were nursing students who came here to the care center, part of their schooling, and then went back to campus. And so this weekend, they're also disinfecting the Lake Washington Institute of Technology. It's just frightening to see how all of this can continue to spread further out into the community. That's one reason the CDC is headed right here in the morning. Live in Kirkland, Allison Grandy, KIRO 7 News.
Yeah, leads from one person to another and another. Allison, thanks. Earlier today, the president held a briefing on the coronavirus. He offered condolences to the family of the man who died here in Washington and discussed the steps being taken to develop a vaccine for the virus. KIRO 7's Blair Miller is in Washington, D.C. tonight with a national plan moving forward. And Blair, this is a fast-moving health crisis, and Washington, D.C. doesn't always move quickly.
Certainly right, Dave, and it's important to point out these are the highest travel restrictions for these countries. Mentioned Iran, parts of Italy and South Korea. We'll have to see what happens in the coming days and weeks as this situation potentially unfolds outside Washington state and other parts of the country. Will these travel restrictions be extended for other countries? Certainly something to watch, Dave.
Blair, at this point, what did the president decide today? We heard him talking, offered his condolences. What does he want to do when it comes to this health crisis?
Well, the biggest thing was those travel restrictions, but also we'll have to see what happens in the coming week, because here at the White House on Monday, the president will be meeting with pharmaceutical companies. It is a big priority for him in all this. He is hoping they can quickly develop some kind of vaccine. Critics saying that may be wishful thinking at this point, but it certainly will be something to watch on Monday here in Washington. Dave?
Now, the president held a news conference today, Blair, and he was questioned about accusing Democrats and the media to a certain extent of hyping this. Did he seem to backtrack a bit from that today?
He did seem to backtrack. He might say he was clarifying that, but the words that were described yesterday that he was calling this a hoax, he tried to clarify some of that today. He was asked repeatedly about that, and he said he was referring to the Democrats on this and tried to backtrack a little bit on this, but it kind of speaks to the politics of all this. It really started developing last week when we saw the big swings on Wall Street. We saw both sides slinging mud back and forth on this issue. People in the middle certainly getting frustrated about the politics of this. Dave?
I'm sure a lot of people are frustrated right now. Blair Miller in Washington, D.C. tonight. Thanks.
The travel industry could suffer as well, losing potentially more than $46 billion a month. United Airlines has announced it's suspending service to major hubs in Asia, and Americans are canceling more trips while travel insurance demand jumped 60%.
We're telling people that they should make sure their health insurance is in place before they go, that they should see their health provider before they travel, and certainly have all their health insurance documents with them when they're traveling.
The U.S. State Department is currently urging Americans to reconsider travel to Italy, where there are more cases than anywhere outside of Asia.
The situation at Life Center is impacting first responders in Kirkland. Tonight, several firefighters were in quarantine after they were possibly exposed to coronavirus. KIRO 7's Ryan Sims joins us live right now from the first station where those rescuers worked. And Ryan, this whole situation came as a total shock to these firefighters.
Oh, it really did, Dave. When they went to Life Care Center a week ago, they had no idea they were dealing with possible coronavirus exposure. 7 days later, this is the result. A fire station that is deserted tonight as its own employees are in home quarantine. Kirkland Fire Station 21, suddenly the new focal point for a worldwide health crisis. Signs are posted at the doors here warning of coronavirus. Nobody, not even the rescuers themselves, are allowed to come in here, all as 7 rescuers are examined for possible coronavirus exposure. None of those firefighters have shown any symptoms, and quarantine, we're told, is simply a precaution. Regarding the disruptions to Kirkland Fire, city workers say it's part of their yearly training to deal with situations like this.
It is a rare situation, but this is not the first time that we've had a potential flu pandemic. So we do have plans in place, and we are, prepared and ready to implement those.
With those firefighters out, resources suddenly stretched thin to keep families safe during this public health crisis. I'm told the department will be relying heavily on its neighboring firefighters should anything huge happen.
We have excellent relationships with our other regional fire departments, and we're making sure that we have all the conversations in place so that if we do need assistance from our partners, that can be provided.
Judging from these signs right here, it could be a little while before life is back to normal, especially at Fire Station 21. And all this, by the way, 2 weeks after Kirkland Fire actually posted job listings saying they needed more rescuers and they needed people to apply for those positions. Now comes this with 7 employees here out on sick leave the next few weeks. We're live in Kirkland tonight. Ryan Sims, KIRO 7 News.
Ryan, thank you. Coming up, we'll take an in-depth look at what the CDC recommends to help prevent the virus.
Plus, Dr. Elizabeth Mead from Swedish Hospital is going to join me for a conversation on coronavirus.
You're watching a KIRO 7 News special, The Coronavirus Emergency.
Whenever you need me, I want you to know I'm here. A hot pursuit. Tonight, a story you'll see only on KIRO 7.
When you need to know, I'll make sure you're covered. Breaking news in Ballard has firefighters scrambling.
If somebody's trying to rip you off, I'll make sure you know. They know they can walk in, take something without fear of being arrested.
And I'll make sure you know about the good, too, because it happens.
Thank you for everything that you've done. I'm here for you every day, so you know more.
Live, local, in-depth, KIRO 7 News.
It only happens once every 4 years.
This week, join us for our leap year celebration.
You get an extra day, and more gives you an extra year.
Instead of getting no interest financing till January 2023,
more gives you an extra year. No interest financing till January 2024, and that's with nothing down.
Living rooms, dining rooms, bedrooms, and more, with an extra year of no interest financing till January 2024.
This leap year week, and more furniture for less.
Ready? When you sell with a Redfin agent, more people see your home. That's because more people visit redfin.com than any other brokerage site. So the right buyers come to you. And you sell for more than the home next door. All for a 1% listing fee when you buy and sell.
How does the automatic emergency braking in the Chevy Equinox work?
Oh no. What?
Can you tell me how lane keep assist with lane departure warning works?
Lane departure warning? What is that exactly?
Kids may not know about the 2020 Chevy Equinox's standard safety features, but every parent should.
Qualified lessees can lease this well-equipped Equinox LT for around $239 a month, or get 0% financing for 72 months plus $1,000 cash allowance on most Equinox models when you purchase and finance with GM Financial.
Wow. You made a mistake.
You just don't know him like I do.
No, you paid too much for those glasses. Next time, go to America's Best, where 2 pairs and a free exam are just $69.95.
Wow, amazing. 2 pairs?
Yep, to have and to hold from this day forward. To love and to cherish.
Okay, I get it.
What about the best man? He seems normal. 2 pairs for $69.95. Includes a free exam. It's not just a better deal, it's America's Best. Buttercream.
Welcome back. Tonight, we want to go in depth on the spread of coronavirus after the first reported death in the state. The CDC believes it's through close contact with an infected person within 6 feet, and it's thought to primarily occur by coughing and sneezing. People are believed to be most contagious when the symptoms are most severe, and it's not clear if it's contracted by touching surfaces or objects, but we wanted to get you at home more answers. So we brought in Dr. Elizabeth Mead from Swedish Hospital, who's standing by with Dave Wagner for a short conversation.
Yeah, and Dr. Mead, appreciate you being with us right now. So let's talk a little bit about this. We have a death in our area, and we have a number of people who are sick with coronavirus. How concerned should we be?
You know, I think the most important message is not to panic. I think it's very important for us to be prepared and really to stay on top of the most current information that's coming out, because it really is changing every single day.
It seems to be. If people are sick or feel like they have the symptoms of coronavirus, we should point out that these symptoms are the symptoms similar to a lot of viruses. What should you do?
That's right. I think one of the really difficult things is that it can be very tough to distinguish this from other viruses. If you have mild or moderate symptoms or think you may possibly have coronavirus, we can't stress this enough. Do not rush to urgent care or the ER where you might spread it to other people. Call your doctor or call an emergency room and find out how you can get tested. If you have severe symptoms or truly need medical attention, it's always fine to seek care, but let them know immediately that you think you may have coronavirus.
If you walk around Seattle right now, maybe hop on an airplane, you see a lot of people with masks on. Yeah. How important is that? Is that really a good idea to wear a mask?
You know, currently the CDC and the WHO are recommending masks only if you have symptoms of something and not if you're well. So we will update those recommendations if they change, but currently we don't think there's a benefit to everybody going around wearing a mask.
It's important to point out here that the flu kills far more people than we've seen with this current virus right now. As we see this kind of move forward, this virus spread, how concerned should we be about that and the deadly nature of viruses?
You know, I think the unknown is always scarier than the known. And so flu is something that we deal with year after year. We think that the mortality rate for this novel coronavirus is about on par with a severe flu year, but it's new and it's changing rapidly. And so I think that it's very difficult to make those predictions in terms of what will happen in the near future.
I know they're trying to come up with a vaccine, but that's a while in the future. Meantime, this virus begins to spread. Are you surprised by how quickly it's spreading?
I'm not, actually. I mean, I think that many of us in the medical fields were sort of predicting that we were anticipating seeing more cases here in the U.S. The new thing that we have is now this community spread, so people who haven't traveled or had close contact with someone who has, and that's something that I think could potentially spread much more quickly.
The fact of our proximity to Asia here in Washington State, does that make it a little more risky for us? Do you expect it to spread a little more here than we might see it in other parts of the country?
Yeah, you know, I think that's an interesting question. We certainly have much more travel back and forth to Asia and to China in particular in this part of the country, so I'm not surprised that we've had some of the first cases. But now that it's in so many different countries in the world and we're having community spread in some of those countries, I think it's potential that it could pop up anywhere.
It's certainly something we're all thinking about these days. Is there any message you'd like to send to the people right now watching this that you think is most important?
Again, I think it's really important to remember that 80% of people who get this virus will have just mild symptoms that will feel like a cold. The mortality rate, again, is only reported at 1.5 to 2%, and we think it may actually be lower than that once we start testing more people. But if you have it, again, the most important thing is not to spread it to other people and to get tested right away so that you can quarantine yourself if you're positive.
And when you talk about the mild nature of this, there may be people who have had coronavirus at home, not even know they've been exposed to it.
Absolutely. Yeah, I think the majority of people wouldn't necessarily know that they had it if they had only mild symptoms. I also want to say that we're seeing very few cases in children, which is a good thing. So unlike many viruses, we're actually not seeing so many cases in young kids.
All right. We appreciate your perspective. It's great having a professional here who truly knows what you're talking about. Thank you very much, Dr.
You're welcome.
Appreciate it. Tracy?
All right, Dave, thank you. The deadly SARS virus that spread worldwide in 2003 and killed 774 people was eventually linked to an animal called civets, often sold in open-air markets throughout Asia. Now it's believed coronavirus may also have been spread from animals to humans. KIRO 7's Amy Clancy went to the Point Defiance Zoo in Tacoma to learn more about the strange mammal that may have been ground zero.
This is a pangolin, the most trafficked animal in the world and one of the most endangered. And now its potential connection to coronavirus could endanger it even more. The link has not yet been confirmed, but Chinese scientists believe that pangolins, native to Asia and Africa, may have first transmitted coronavirus to humans in Wuhan. The mammals are prized for their scales, believed to have medicinal qualities, their leather-like hides, and for their meat.
I believe it sold for about $150 a pound.
It is illegal to sell pangolins worldwide. They are an endangered species, but they can be found at open-air markets throughout Asia. And it is believed that's where they may have passed the deadly virus to people.
Well, I wasn't surprised when I heard that there might be a connection.
Karen Povey is Conservation Engagement Manager for Point Defiant Zoo and Aquarium in Tacoma.
When you put animals in these very stressful environments, then they become sickened and weak. That's when some of these viruses can become more active. When the SARS epidemic was in place, that they did shut down the wildlife markets for a time because there were definite links between wildlife and that disease, so that could perhaps have the same effect here.
Povey is concerned about the future of pangolins, even if no definitive link is ever made between the animal and the deadly virus.
They've already had tremendous pressures on their populations, and now if there's this connection of people feeling fearful because they may be disease carriers, there may be even more reason for people to want to try to kill them. They are so close to extinction as it is that another problem is certainly going to make things worse.
One potential upside, if there is a connection to coronavirus, that connection could lead to more conservation efforts. Reporting in Tacoma, Amy Clancy, KIRO 7 News.
The stuffed pangolin Amy was holding was confiscated by state fish and wildlife agents. It is against the law to bring any pangolins live or stuffed into Washington under our new animal trafficking law. Dave?
Well, tonight, hospitals around the country, they are getting ready to handle a potential coronavirus outbreak. Coming up, the reason they're asking you to call before coming in with a cough.
You're watching a KIRO 7 News special, the Coronavirus Emergency.
Reporting live in Newcastle.
In Goldberg.
In Olympia.
No matter when stories break. Market Street completely shut down. We're live, showing you what's going on.
In Renton.
Shoreline. West Seattle. No matter where you live.
Snow all over Puget Sound.
We're local, in your neighborhood. Live in Lacey. Everett. In Bellevue. No matter how big the problem.
They don't know what's out there.
We're in depth, getting you answers. Because what matters to you matters to us, too. KIRO 7 News is everywhere. Live, local, in depth.
75 years ago, Freddie's grandfather started a family business. Now it's the pride of the neighborhood. He's celebrating with a brand new look brought to life by the designers at Vistaprint. It's your dream. Own it with Vistaprint.
The insurance adjuster was nice after my car accident. Said that he'd take care of me. I thought I could trust him. Turns out, I was wrong. He tried to get me to sign a settlement for $450, even though I owed thousands of medical bills. So I called Bernard Law Group. It was the right call. Instead of $450, they settled my case for $99,000. Bernard Law Group is a good call.
Bernard Law Group, 800-690,000. Why settle for less?
Update your floors with Empire Today's $50 room sale. Buy one room, get floors for all other rooms for just $50 each. So when you buy one room, it's only $50 for laminate in the kitchen, $50 for carpet in the bedroom, and $50 for hardwood in the office. There's no limit. Buy one room and it's $50 for floors in each additional room. Schedule now.
800-588-2300 Empire.
Today. Selfie?
Yeah.
Uh-oh.
What?
I think I forgot to lock my Buick. Got it.
At least your Buick's locked.
At the heart of every Buick Encore is you. Pay no interest for 72 months on most 2019 Buick Encore models. Or get $4,000 purchase allowance plus an additional $750 purchase allowance for current eligible GM owners.
At Papa Murphy's, we're making flavor magic for just $10. Introducing the new Combo Magnifico, a magical combination of giant pepperoni, sausage, mushrooms, and onions, all for just $10. Bake it yourself, then make it disappear. We make it, you bake it, Papa Murphy's.
As we continue to go in depth tonight on the coronavirus, hospitals nationwide are now preparing for a surge of patients just in case an outbreak comes to the U.S.
KIRO 7's Dee Dee Sun spoke with administrators at Bellevue's Overlake Hospital about how they're getting ready for the worst case scenario.
This sign, mask required for fever and cough, is one small change you'll notice.
So that we're exposing as few people as possible.
It's up in response to the growing concerns of a coronavirus or COVID-19 outbreak.
But behind the scenes, the work to prepare is constant.
Most hospitals, as well as Overlake, are erring on the side of caution. We really have to protect our other patients. We want to do the best that we can for our own patients.
The Washington State Department of Health is working with hospitals to get them ready. For example, what they would do if a lot of people started getting sick at the same time.
Strategies to try to increase the number of patients that can be seen. First of all, they could think about, putting patients in certain spaces in their hospital that they may not normally use.
Hospitals also told to assess their supplies of things like masks and protective suits necessary for testing someone for COVID-19. Getting a swab sample from a possible patient can be complicated.
To safely do this for a healthcare worker, you would have to gown up with an N95 mask, a face shield, a gown, gloves, and then do the swab. So that is not a small undertaking.
Those swabs can now come to the state's public health lab in Shoreline, which started testing nearly a dozen samples today.
I realize that these planning efforts, may be concerning to some people, but there's really no need to panic.
I checked with most of the major hospitals in our area, from Harborview Medical Center to VA Puget Sound Healthcare to Evergreen and Overlake. They're all recommending if you have a cough or other respiratory symptoms, call before you come. Dee Sun, KIRO 7 News.
And KIRO 7 will continue to follow tonight's breaking news on the new cases of coronavirus in our state.
Just to recap, health officials announced today that one Washington patient has died. He'd been admitted to Evergreen Hospital. The man in his 50s is the first death from the virus in the U.S. Officials say he had underlying health conditions. This comes as dozens of people at a Kirkland nursing facility, including some first responders, are being quarantined and tested for the virus.
And we will have much more on the coronavirus online and again tonight at 11 o'clock. Thanks for watching this KIRO 7 News special. We will keep you up to date on this health crisis. I'm Dave Wagner.
I'm Tracy Leong. Have a good night.
This has been a KIRO 7 News special, the coronavirus emergency.